Here's another drug in the reproductive system, darolutamide with the brand name of Nubeqa. It is an androgen receptor inhibitor. Nubeqa is a drug made by Bayer and has a purpose of treating men with prostate cancer that has not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone. Darolutamide's mechanism of action is that it is an androgen receptor inhibitor. It competitively inhibits androgen binding, androgen receptor nuclear translocation, and androgen receptor mediated transcription. A major metabolite, keto-darolutamide, exhibited similar in vitro activity to darolutamide. In addition, darolutamide functioned as a progesterone receptor antagonist in vitro. Darolutamide decreased prostate cancer cell proliferation in vitro and tumor volume in mouse xenograft models of prostate cancer. Nubeqa is available in the market in tablet form, containing 300 mg of the product, and it is a white to off-white film-coated tablet marked with 300 on one side and Bayer on the other. Nubeqa's recommended dose is 600 mg, which should be taken orally, twice daily, and with food. Darolutamide is a structurally distinct androgen receptor inhibitor with low blood-brain barrier penetration and low potential for drug-to-drug interaction. Darolutamide is a next-generation androgen receptor antagonist with a distinct molecular structure compared to enzalutamide and apalutamide, and preclinical data suggest more potent androgen receptor inhibition, negligible blood-brain barrier penetration, and no activation of androgen receptor mutations such as androgen receptor F877L. Moreover, Phase 2 and Phase 3 data demonstrate high anti-tumor activity and a very safe toxicity profile similar to placebo in the ARAMIS study. Therefore, darolutamide has shown low blood-brain barrier penetration, and this may be associated with preclinical and clinical data that show low proconvulsive potential. Darolutamide was associated with a greater benefit in all secondary and exploratory ARAMIS endpoints versus placebo. From a safety perspective, the overall incidence of adverse events is low, and darolutamide appears to be relatively well tolerated. Darolutamide demonstrated a significant improvement in metastasis-free survival in patients with castrate-resistant non-metastatic prostate cancer, with a PSA doubling time of less than or equal to 10 months and PSA levels of greater than or equal to 2 nanograms per ml.